Hi, my name is Dr. Don Stader. I'm coming to you from beautiful Golden, Colorado, and I'm the president of Stader Opioid Consultants. And we're an organization that really focuses on improving addiction care and in communities and in hospitals. And it is our great pleasure to be working with Impact Behavioral Health to really build addiction infrastructure in communities across our service area, and especially standing up addiction infrastructure in hospitals. Through Impact Behavioral Health, we've been able to stand up addiction treatment at Valley View Hospital for pregnant persons. And we've done this through direct engagement, communication, planning, and partnership with the providers at Valley View Hospital, working directly with their nurses, with their social workers, and with their frontline clinicians to teach new skills, i.e. the skill to treat addiction, and then to teach how to implement that with patients that might suffer from use disorders. And we've done this at several levels. The first is around treatment of pain in addiction. We've done an analysis of what they're doing to treat pain, and they're actually treating pain very well and without many opioids. The second thing we've done is really implement a harm reduction program. And through Impact Behavioral Health and with Valley View Hospital and partners, Valley View has become the first hospital in Colorado that has an opt-out naloxone distribution program for pregnant persons, which means every pregnant person is offered naloxone and counseled about drug use and the potential for overdose if they are using drugs, and then how to prevent those and how to respond with naloxone in case someone does have an overdose event. So that is state leading when it comes to harm reduction. We've also been working directly to build new addiction care systems so that if a pregnant person comes in and they suffer from an opioid use disorder, the hospital now has the tools needed to actually initiate methadone, initiate buprenorphine, and know how to do that with alacrity. And then finally, we've really helped connect the dots between what happens when that person is discharged from the hospital and to continue that outpatient care so that we can continue to treat the medical disease of addiction and ensure better results and better outcomes for pregnant persons and families that struggle with use disorders. I believe that the impact that we're having through our partners with Impact Behavioral Health is going to be tremendous. We're talking about expanding the medical care available for patients who suffer with substance use disorders and the disease of addiction. And if you believe that that addiction is a disease, which it is, we know it's a disease, then whether or not a medical system is able to treat that disease often dictates whether a pregnant person lives or dies, whether they recover or whether they are lost. So I cannot overstate how important it is that we've engaged medical communities in providing this new health service to pregnant persons who may be struggling with addiction. And especially when viewed in the context of overdose being a top killer of pregnant persons across Colorado and in fact the country, we all need to be doing this with much greater fidelity. Pregnant persons with substance use disorders deserve treatment. And now through Impact Behavioral Health and the work that we've done at Valley View Hospital, that hospital system and their patients are able to really meet that standard of care. And I have no doubt that it will save lives and get more people into recovery as time passes. I think one of the strongest things about Impact Behavioral Health has been the multifaceted way that they've looked to build infrastructure and to meet the many needs that patients have that struggle with substance use disorders. We know that people don't live their lives in the hospital where our primary intervention is based. We know that most people live their lives in their communities, and that health isn't just about medications or about procedures. It's really about how patients are living. And the fact that Impact Behavioral Health interweaves these different aspects of the social needs of a person, the food needs of a person, the medical needs of a person, I think really helps assure that we have one of the strongest programs in the nation when it comes to addressing the needs of pregnant persons with substance use disorders. And I say that it's been an absolute pleasure to be able to step out and work collaboratively with different organizations to really build a health infrastructure that will work for patients in the community served by Impact Behavioral Health. I couldn't be more enthused and proud of the work that's being done to stand up care in these communities. When it comes to advice, I think the first thing I'd tell people is you don't have to reinvent the wheel. We have worked very hard on building a cohesive, collaborative, and integrated system within Impact Behavioral Health. And I would hope that other communities that are looking to implement something similar would look to the leaders that have already built this as part of our first round of impact. And then moreover, I think that I tell people, besides the fact that, hey, you don't have to reinvent the wheel, is that it's possible. It is possible for us to build a system that saves lives and enriches lives of pregnant persons affected by substance use disorders. We don't have to lose another mom to a preventable, treatable disease. And I would hope that all of you, seeing the possibilities, would be inspired to take those next step forward and to adopt either Impact Behavioral Health or another similar program for your pregnant persons with substance use disorders.